What about the risks of limb lengthening surgery, doctor? Is it a risky surgery? Are there complications? Yes, any surgery has complications. And the major risks involved in limb lengthening surgery are categorized in different groups. So we have the risks of surgery that revolve around the intraoperative and the shortly post-operative period, so that period directly around the operation. And those risks include things like fat embolism syndrome, blood clots, bleeding, nerve damage, and intraoperative risks of anesthesia. The second group of risks involve the risks revolving around stretching the muscles and the nerves. So these are joint contractures, joint stiffness, difficulties in walking, and these type of complications. The last group of complications involve things like long-term complications, athletic recovery, alignment, arthritic problems, and that group. It is important to do the surgery in an environment where people limit the risks as much as possible. And we limit those risks through techniques like the right drugs, the right preparation for theatre, fluid balance, meticulous monitoring, and using specialist anesthesiologists. Joint contractures and nerve irritations, those are taken care of by our physical rehabilitation team, by making sure that we have the right rehabilitation specialists on board and that they can monitor you meticulously. Another strategy we employ in terms of controlling joint contractures, muscle stiffness, is to play around with the rate of distraction. So sometimes we can slow down the rate of distraction a little bit for the soft tissues to catch up. But that should only be done under the supervision of the surgeon because it can be quite risky to do that and you can have premature consolidation. Late risks of limb lengthening surgery, like arthritis, malalignment, athletic recovery, those are very difficult to predict and very difficult to quantify as we simply don't have the data scientifically at the moment to tell us what those are. But if you stick to reasonable lengthening limits, if you stick to a surgeon that can employ the surgery safely and effectively, and we can preserve the alignment, you should have a near normal recovery in the long term, and we do not foresee any long-term problems like arthritis or late complications.